And then the daughter was there saying, okay.
They're just there's no movement
Now,
right? Or
let's move on to Parkinson. That's
or
first.
is there consciousness of what you feel?
One more thing about seizures. The medications that Professor Denson mentioned, she mentioned Tegretol, she mentioned Dilantin, and what's another one?
Phenobarbital?
Depakote. One thing about Dilantin that you need to know, Dilantin can be given IV and PO. Depakote, Depakine, Tegretol, Phenobarb, those are oral. Those are usually oral medications.
What you need to know, test purposes, they're anticonvulsants. The person, what those medications do, they heighten the seizure threshold, meaning they don't go into seizures as readily unless they don't take the med. And then to assist so that they don't go into seizure again, that's when you give the Ativan or some type of anti-anxiety med. So they don't go back into the seizures readily. These medications, the anticonvulsants and the Ativan, cause the person to be lethargic. They can often, because they're reducing that stimulus, and they're a safety risk when they take these meds. So you need to make sure you're doing your initially 30-minute checks and then delegating hourly checks on this person, okay, while they're hospitalized.
Dilantin causes with the
Hyperplasia of the gum. You do need to know that.
What is it?
2 times, 3 times, whatever. Dilantin taken consistently over years causes hyperplasia of the gums. They just come hypertrophy and they bleed.
Hyperplasia of the gums?
So what will you do
Yes.
without a doctor's order? Offer some type of oral care. Non-alcohol based oral care. No lemon glycerin swabs. So these little toothets work, but you don't want alcohol based. This time, let's change it up. This person has Parkinson's. Parkinson's, a disorder affecting movement involving the basal ganglia and substantia nigra. You don't need to know the locale, but know it's there. Pathogens-wise, it involves the imbalance between acetylcholine, which is a neurotransmitter, and dopamine. These people have low dopamine uptake in the brain. There's an imbalance between acetylcholine and dopamine. There's different stages, but when you see the people, the ones that manifest more readily for you is when they have that akinesia. Their gait is ataxic, their arms, they're trembling, they're rigid. Then they eventually get where they're total dependence. They're bedridden because they don't have the gait patterns, they can't move the musculature. The rigidity sits in so bad that they're bedridden. Initially, what you might see, going back to the beginning, is people just have trembling when they're walking. You'll see them walking in the mall or something, and they're just trembling. But what happens is the stiffness comes in, and they're having the stiffness getting somewhere plus the trembling. We don't know the exact cause, but they find that there's some correlation with environmental and genetic factors. Rural living, where people have had wells, the water from wells, there's some correlation, not proven. Well water consumption. They've even had some history genetically that too much protein buildup in the brain does affect have a max, kind of like low affect, low affect, a max like this. There's drooling because they can't tolerate, they can't control their salivation. So there'd be a problem with certain foods. They have a stoop posture and some shuffling of the gait. Tremors, and you'll see them with their hands peel rolling like this, and plus tiny little tremors. There may be some dementia in late stage. That's a mass looking thing. There's some rigidity that I see on this side of the body. And if this was blown up, I bet you there'd be some drool.
Parkinson's pretty well controlled. I mean,
If
this
you-
stage.
Yeah, it's pretty much controlled if people keep on medication. We know that they have self-care deficits depending on the degree of the lack of dopamine or the receptors for acetylcholine. Nutrition, I'll just tell you what self-care deficit, let's start there, neuromuscular impairment. They're high risk for falls. You want to assist them, but do not take that autonomy away. You want to assist them in walking, transferring to bed. With their ADLs, you want to assist them. Don't do it for them, but for their level of functioning. Even though they're shaking, you need to assist them with foods when they're eating. They need to eat, I'll say this, you need to know it. Give them finger foods, soft finger foods that they, as they're drooling, they can get into the mouth. It's not the time to give them soup or what's that thin soup, consuming or whatever. You don't want to give them soup because what's going to happen? They'll shake. So things like soft peanut butter sandwiches, cheeses, things they can hold in their hand. Okay. If they cannot tolerate their secretions, what are you going to do to the fluid? They can't tolerate their fluids.
Oh, thicken.
You want to give that. They can't enunciate as well in certain stages. So what would you allow with them? What would you do? You want to allow them time to enunciate. If I'm up here, you try to anticipate to the patient. Mom, would you like, if it's a mom, would you like something to drink? And she, yeah. No, they're nonverbals. Okay. These individuals, they have problems with body image. They can see themselves just kind of trembling and trying to get here to there. They know they're prone to falling. It's a self-esteem issue that can occur with these people also. Men and women. Rule of thumb, if it's a dopamine med you're giving because they're low in dopamine, you want to give like anything DOPA, that's a dopamine derivative, that will increase their dopamine uptake. A brand name here, a generic here. And again, these meds are used to increase the dopamine. Adverse effects, though, is involuntary movement. They don't control, they don't have enough dopamine, but these meds can exacerbate some of the musculature, or that they have involuntary movement, nausea, and some vomiting. So GI disturbance and musculature. What you want to do as a nurse is explain the drugs, warn to avoid sudden posture changes because they are already attached. So you want to assist them with movement. Avoid foods high in vitamin B6. Those are meats. So if it is meats, it's lean meats. You definitely don't want to give them liver. You wouldn't give them meats like maybe some chicken, fish. That's not the time to be trying to give them a ground steak. You want to give them some foods. Avoid foods that are high in vitamin B6.
Is that because it inhibits the dopamine uptake?
It interferes with it. Okay, if they're not having trouble sleeping, you may want to give the dose earlier in the day so that you can have a blood level to assist the person through the day. It may cause drowsiness, so this person needs to avoid driving. However, I was right at the gasoline station just the other day, and I saw this little guy shriveling. He was driving some fancy new cat or something. I said, Lord have mercy, you may not have that long. But anyway, the thing is, but he was driving, and he has the Parkinson. Okay. Now, I'm going to stop right here. I want my crew to get up. Set the scene. There's a main caregiver, Sarah, and there's two other daughters who have just come to visit Mama, and she's the main caregiver, and they're ones who are hotsy-totsy coming in, Johnny-come-latelys, who are coming in and intervening and trying to give her some stuff and a lot of attitude relative to the care of Mama. And one thing about it, people with Parkinson, it wasn't a sight, but they can have mood changes. They can get very irritated, especially when you're trying to direct them. And I'm at the stage where I have the musculature manifestations, and I'm irritable, and I'm drooling. What med group could be given to me to control my drooling? Yeah, anticholinergic. Okay, what is Mama going to manifest if she's taking these meds? I mean, body-wise, GI. What might they have GI?
Urinary retention.
Yeah, can't see, can't move, spit, all of that, okay? Okay, so, here we go on the scene. Is that Glorietta and Mary?
Glorietta.
What y'all doing here? Honey, y'all make me sick. Okay.
What did you tell her?
Mom, it's okay.
Give me a chair. I'm about to fall. I'm glad to see you, but y'all
You
make
want
me
a chair, Mom?
Why does she like you so much?
Can you give me a clinic?
Take care of her.
You see your mom drooling? Can this
Mom's drooling. You just let her drool all over herself like this? Like, have you
Okay.
even been taking care of
You
her
can
at
go
all?
get a Kleenex if you want.
Did she change her clothes today?
Well, I let her try to pick her own stuff.
You
Yes.
don't dress her nicely to be presentable to
Well, where have you guys been?
take over yourself. As if y'all been here.
We've been paying for it. You upset her.
Oh, I've upset.
Yeah.
You guys are the ones that are never around. I'm the one taking care of her all the time. She can't
Well,
pee.
maybe we should.
She can't I gotta wipe her, bathe her, help her dress, watch her tremble.
You obviously can help her dress.
Well,
If y'all would buy me some new clothes,
that's
Don't
right.
buy her new clothes.
That's right. You guys are the
Oh,
ones
I
making the
said
money.
you.
Glorietta.
I'm hungry. Did y'all bring me anything? You help her out?
Of course they didn't.
You didn't make her lunch already? It's like 3 o'clock. It's almost dinner time.
She had lunch. She just doesn't remember. she's hungry
Tell
again.
them there's some food in the refrigerator, and I don't want you to do it. I want them to give me something.
Yeah, we all do for something.
Yeah, you guys go
apparently
to
fix for
Tell
us.
them what you
I'm gonna check her out. There's some peanut sandwiches in the fridge.
Here you go.
That's not peanut butter.
You don't even know. Don't you know what peanut butter is?
You feel like really? It says peanut butter.
Sandwiches.
I think she will.
Why do you care? Because I don't want my mom to be able to see what she's dressing herself in.
She can see just fine.
Obviously not colors.
Oh, my stomach feels funny. I can't move it. Oh my Lord.
Maybe
My
when you
my
guys went to
bladder
turn help her
feels-
to the bathroom.
No, I actually
You can take a turn wiping her this time.
Okay.
Elaine,
No, Mom, I actually, it was so nice.
what are you doing?
I have to meet work, school thing.
You should have your hair highlighted more.
Hold up. I'm the mama here. I'm the mama here. Y'all need to start helping her out.
She works.
I'm too busy taking care of mom.
I go to work and I go to work.
Come up here. Let me tell y'all. Y'all need to start. You know, I'm just getting so nervous. I've been stuttering a little bit, but you know, y'all need to start helping her out. I need food that I can get to my mouth instead of my clothes. I need y'all to take me to my doctor. Okay, y'all just live down the street. Why haven't you been here? Why haven't you been here?
Or
And I need y'all to be more supportive of her because I need all my girls. Don't get me to crying.
she wants to go work my job, probably I'll be here all day.
Okay.
Peanut butter jelly sandwiches?
That's right. Oh, I could go to nursing school. Like it's hard.
Okay. All right, let's change gears here. Okay. What is this diagnosis? It's Parkinson, but what's going on with her? Dysfunctional family, caregiver role strain. I don't know what's going on with these. They're not involved. But who could assist this whole family?
Healthcare.
Case management, home health care visits, targeting what? They didn't know what's going on with her. Communication. They don't know my nonverbal cues, but she does. She needs to start telling them even though they don't want to listen. Even before case management comes on. Respite care for her. These ain't no good. Okay, what about food? How would they prepare it? They could bring stuff in. What could they bring in? Finger food. If they don't want to cook it, where could they get it? Chicken nuggets, if that's in the diet of that person. What else? Oh, what is she at risk for if they give her hot dogs?
Choking.
Choking. She can't tolerate secretions. Okay, what can they do, all of them, to assist me with the side effects from the anticholinergics that are given to me? Encourage fluids. They could bring some fluids to me. When they come to visit, they could walk with me. I walk slow. And they may not, attitude, they may not want to walk with me, but that's helping. What else? They could send money. Financial support. What medications may be given to enhance GI elimination? Folate stool softeners. And sometimes methylmagnesia might be needed. What foods? Fiber. Fluids, fiber, increased fiber, medication management, stool softeners, methylmag if need be. And doesn't stress have a lot to do with decreasing motility? It can go both ways. But with this person who's already taking medications that slows down motility, you want to minimize as possible the stress. It may be that they need to limit their visits because it upsets the mom, but they still need to come. Send money, yeah, send money to help. Okay, respite for her, encourage involvement from the others. Thanks. What would they need to do in the home? If a nurse came for a case management home visit, what would they be looking for that might be hazardous?
Pets.
Pets. Cats. So you said animals. You said throw rugs. Clutter. Old people like to hold on to stuff. Okay. Other safety issues are, it may be that this person needs to have an assistive device for walking. If she does not have a mechanical assistive device, just someone who's trying to guide her walking. Keep in mind that the dopamine has side effects. You give an anticholinergic to diminish the side effects from the medication. Okay? That's why you have that side effect. That's why you give an anticholinergic to assist them. One anticholinergic that you guys have
So you give her that to help
heard
her
of
do
is
it.
atropine. But if I was given atropine, what might you see relative to my pulse? Does atropine? Oh, it would increase if they got atropine, because atropine is given for what? Remember the pulse is low, atropine is given for brain infarct. Okay, it might increase. But atropine is anticholinergic. There might be other anticholinergics. But if you give anticholinergic, it's important to teach the caregiver and the patient what it's going to do to the person. These are other ones that are used, but your anticholinergic is what you need to be. Okay. This time I want the players first, then we'll go into
I need a minute.
the scenario here is I have a daughter. We're a very religious family. I have Alzheimer's, but I'm in a stage where I'm still a little aware of things, but my memory is just here and now. And we'll go over the key things to remember. My daughter doesn't believe I have Alzheimer's. She thinks I'm going to be healed. She hasn't come to grips with the diagnosis. And she has a little fear of what may occur to me and what may occur to her. But all you hear is this religious banter back and forth. She has gotten to the place where she has called in additional religious help.
He's getting ready.
Okay. And there's a home health nurse doing a home visit and having to take down all of what she's seen. Okay. Is our person, clergy or whatever. Not yet. Okay, furthermore, let's talk about this. Someone who has Alzheimer's. What do you report your Alzheimer's patient? Yeah, we did yesterday. Oh, yes. Okay, describe that person while we're waiting for him to.
She kept repeating stuff. She was angry with her daughter for letting us do that procedure.
And
Oh, yeah, she was putting it in her ear.
She was we were putting down an NG tube. Matter of fact, Miranda put in for her skull an NG tube and an Alzheimer's patient. Okay. So, now, what we're gonna do now is go into our scenario. This is an Alzheimer's patient, and I'm gonna be going into. I'm coming in from the outside, and my daughter's waiting. She's been watching to make sure I'm getting the fresh air, and I'm coming in. And I'm where I have remote memory, but right here now, I don't know what's going on. Marietta, is that you?
Yeah, is your walk okay?
Yeah.
You feeling all right?
Yeah.
We have some people here to see you.
Hello, Sister. Sister Mariana has contacted me through the Craigslist. We are here to help you.
She's having a hard time, Mom. And I thought that, the pastor could come and help you out.
Who's that?
That's the home health nurse.
She looked like
I know, I don't know why she's here.
Joanna, your sister.
No, she is nothing like her.
We must exorcise these demons that are in control of you. Oh Lord!
Don't touch me.
Come down and take these spirits out of her. Okay.
Right there. Lord help me. Amazing grace.
Vivian?
How are you?
My name's Shirley. I'm a home health nurse.
Oh,
You know what today is? Saturday. Okay.
Is tomorrow Sunday?
Well, no, but that's okay. How long has your mom been having problems?
She's not having problems. She's fine. She just gets a little forgetful sometimes, but you know what? She's all right. Well, we just need to pray a little harder
Is she driving still?
when she wants to.
Have you ever gotten lost? Didn't remember?
Well, they said I was at home and I had my gown on and everything, and I walked up to my neighbor's house. But I knowed him. I thought my neighbor's house. And he saw me with his eyes got big. I don't know why. I had my gown on.
Have you gone to the physician? Seen the doctor?
Yeah, he seems to think that she has Alzheimer's, and I guess that's why you're here.
Yeah.
But she just forgets sometimes, but she's okay. That's why I called the pastor in. She just needs to pray a little harder, have a little more faith.
Well, that's good that you've got support. It's really good. But I think she needs some help with a physician as well. What's happening is she's got the beginnings of Alzheimer's, and
So what does that mean?
well, she's forgetful. You've seen that happen.
Is that,
Easy.
but she's gonna be okay, right?
I get a little confused when my daughter just yells at me, and she says that.
Well,
"Mama,
she
you know
knows
that."
what stuff's that, but she pretends like she doesn't.
Can you bring me my comb? Is there my comb right over
No, that's your toothbrush.
Okay.
I told you that already today. We already went over this.
She just yells at me, and I just look at the road.
Good old holy water.
You were the right pastor to call.
You did it.
You stay off my mama.
Checking the mail.
Check it out. Is she on any medications for anything else, or
No, it's your vitamins.
your vitamin?
Yeah. Her omega-3s.
Okay. Are you her only caregiver? Does she have any?
No, it's just your time.
Do you have any
my
other?
phone.
No, Mama, we've been through this. Your comb is over there with your toothbrush. You're fine. You don't need that right now. Your hair's beautiful. It's good.
you have any sisters or brothers nearby, or
No, or not close by. It's just her and I.
do you have a lot of other family support, or people?
Yeah, Christmas and Thanksgiving. But no, it's just her. There's your brother over there. Oh, Lord have mercy. That's that crazy pastor that I should not have called. You're welcome.
You're welcome.
I think we need to bring in, if it's okay with you, a case manager. And this is just more to help you out. I'm not,
Okay. Well, she's gonna be all right though, right? Like she's gonna get over this and be fine, right?
you don't get over Alzheimer's disease. It's
But my
progressive.
mama will.
No, it's gonna be, as time goes on, it's gonna be more difficult. She's not going to remember as much as she does now. There's really, you can give her some medications, but it won't stop it.
I just need to be pastor. We just need to find a pastor. I think you're gonna be just
Don't
fine,
take
right?
my church away from me.
No. We're just gonna find you. One that you know. I'm making your life hard, aren't I?
Honey, now I'm gonna have to go to the hospital. No, Mom, we're fine. Ain't nobody.
Well, that's why I'm here, so I'm here to help out. And we can have someone come in, and if you want, give you a break. I know it's gonna be kind of hard, you're here all the time with your mom. So, that's what we're here to do. But I can give you some more information, if you'd like me to talk to the case manager, I'll sit down and discuss, what's going on in your mother's care.
Y'all not talking to me.
Well, I can talk to you. What do you want to see happen? You said you wanted to
I
stay
wanna
at
stay
home.
with my daughter.
Right. We're not going to take you from your daughter. You can still go to church.
But she said about healing. What I need healing.
Just, to help bring her back.
But when she talks, it makes me nervous and I get worse. I can't remember anything.
Wow, you would forget everything all the time.
Oh, no. Let's bring this all together. People, what is she going through? I was diagnosed with Alzheimer's. What is she going through? Denial. Okay? And she probably is stressed as all get out. They're a religious family, so they believe in healing. But what do we know about dopamine? I'm not dopamine, but see, I'm forget it. Anyway, what do we know about Alzheimer's?
It's progressive.
You can't diagnose it. There's just symptoms that correlate with it. It's generally diagnosed upon autopsy, where there's the entangling of nerve fibers. There's some high correlation that people have it by the symptoms they have. The progressive forgetfulness, decline in ADL, decline in meeting their overall daily needs. How could you help this daughter? Oh, Who is popping that gun? How could you help this daughter?
I'd probably talk,
Huh?
when I actually talk to her alone and ask her, it just seems that you're having some issues with, that your mother might have Alzheimer's. What are your feelings about it? Try to
I think she needs somebody that she's not probably not going to listen to a counselor, but if you found a pastor who could talk to her, that's what she seems to relate to. That can help. Yeah,
One pastor, one name. What would he make a true Alzheimer's feel like?
An idiot.
Stressed, increased anxiety, something's wrong big time with me,
Demon in you.
or I need to be exercised. But what could he have done
know, instead of squirting water and hey, you know, this type of thing. So you want to have a calm environment for this individual. If they're walking, let them walk. You don't, as long as there's safety surrounding. Most of your Alzheimer's have locked environments so they can roam. I'm not yet, based on the scenario, at the stage where my daughter has to do all of my activities of daily living or assist me with. But even at that, she needs to control my autonomy and what I can do. When I pick up the wrong thing, she'd say, Mom, she needs to say, this is your comb. This toothbrush is not your comb. Because they have that. What about that toothbrush makes her think that it's a comb? The bristles and the handle. So they have some degree of understanding, but those nerve fibers are taken. Okay, good. All right. So let's move on to this is the debilitating stage of Alzheimer's, where this person's bedridden, can't take care of any of their ADL. There's different stages of Alzheimer's. I'm not going to get into that too much, other than forgetfulness that is different from your norm is the first sign. Forgetfulness, inappropriateness of dress, inappropriateness of relative to seasons. You'll see some Alzheimer's patients that it's the it could be 110 outside and they have a coat on, or it's in the cold of winter and they may have some shorts on, and the tank top. That's appropriate for them because of how the tangling of nerve fibers. Neurofibrillatory tangles, fibers, proteins within the brain. Plaques, and you know all of these interfere with the neural transmission. Fibers in the plaques. Granulovascular degeneration, they're not getting the perfusion. Right. And what happens, atrophy occurs. Even though there may be tangling and plaques, atrophy occurs. And on the autopsy, say a normal person who's 45 years old, their brain would be far outweigh a person with Alzheimer's. It says no ways to prevent, but I can tell you, there are some things you want to keep active. You can't prevent the tangling, but you can keep those brain fibers to the transmission to be enhanced to some degree. You want to encourage people, if they read the newspaper or novels and what have you, keep that brain active. That's why it's important to encourage them to go to elderly day centers so they can interact with their peers. Card games, bingo, all of this stuff to enhance that neural transmission. A balanced diet is very important because you need those healthy nutrients, your vitamin B12, C and E. Vegetables, soy products, if they're into soy, you want to have a balanced diet to enhance the neural fibers in there. So even though there's the fibrous and the plaques, but you want that transmission. You want to enhance that transmission. NSAIDs can be given because of their anti-inflammatory effect, because it's such inflammation relative to the plaques and the fibrous tissue. If you give an anti-inflammatory, non-steroidal, it decreases the intensity where the transmission, it decreases the intensity of the transmission not getting to one point transmission. Forgetfulness is the first. They have short-term memory loss. Like in the scenario, she told me, I asked her, I want to comb my hair. Okay, I knew I needed to comb my hair, but at that moment, I picked whatever resembled a comb and started combing my hair. If she hadn't told me, I need you to go to the bathroom, I would have said, yeah. And then would forget to pick up my feet and go to the bathroom. Okay, I can remember remote memory. So with these people, if they can't remember their kids and what have you, bring them a picture of those kids as they are now. As they are now and what they were. Explain to them, if you can, this is your son Joe. This was Joe. Will they remember it 5 minutes later? Probably not. But that's how you try to bring them back to what's here and there. Over time, it's not a priority for them for personal hygiene, appearance, and concentration because it's not really their fault. They're not getting that neural stimulus to remember that it's important to have hygiene and promote optimum appearance. You want to assess for attention and concentration, judgment and perception. If they have problems with perception, they're a safety risk. These are people where you need to have your doors. If they're ones who roam in your house at night, you want to have high deadbolts on your doors so they can't get out. You can let them roam, but if they're in a room by themselves, make it a room where it's big enough that they can roam within that environment. Allow them time to enunciate and speak to you. If they're having difficulties in communicating with you, that's the time that you need to remember nonverbals, anticipate their needs. If this is a person that gets up in the morning and they forget that they need to go to the bathroom after breakfast, you walk them to the bathroom so they can then stay on that pattern. Some of that nerve impulse will go through, but at times it's going to degenerate. The main thing, allow them time for activity, allow them time for speaking to them. Self-care, the main thing is promote their attention for their levels. If it means that you need to, they have loss of bowel and bladder, in stage you need to institute incontinence care. And do it totally if they cannot take care of themselves. If they have a decreased appetite, what would you do? What would you, say you're a home health nurse, and you go in, how could you help the caregiver decrease the diet of this person?
Pick foods they
High
like.
calorie foods, unless the person has a lot of adipose. Okay, high calorie foods. What type of high calorie foods? What's going to be the texture of it? Similar to what we did with the Parkinson patient or any neurological patient. Small finger foods, high calories. Okay, say they're not getting enough. What's on the market that they can take?
Sure.
Ensure. All these ones, Ensures. There's so many of them. in between their days. Insurance is not their only guide. They can become aggressive, so what do you need to do? I just said a while ago. If you don't want someone to escalate, what should you do? Talk. You want to use sentences, allow them to enunciate. You don't want to yell at them, even though you may be frustrated. It's not the time to bring in some holier than Joe priest and their pastor, because that's going to aggravate them. You want them to avoid, you want to anticipate that they may have mood swings. Some days they may not want to do anything. A lot of times, layman's terms, we'll call them sundowners. Seem like at nighttime, like about 5 o'clock out, they get loopy in the hospital. They just start forgetting more. They start wondering, and you want to know where they are, and they're not anywhere where you would anticipate them to be. They're wanderers. They become delusional. They'll look over there and say, "Oh, there's my son," and here it is, maybe a teddy bear, or it may be a statue. And depression sets in also because they want to do better, but they can't. Just go over some of the nursing diagnoses. Intervention, you want to stimulate them, encourage them to be any of their peers. Okay, structure the environment. Prevent overstimulation. It's not the time to take them to a family barbecue and they get so tired and they're just, it just messes with the synapse and the nerves. Okay, nerve and stimulation. Provide consistency. It's not the time to, they're taking care of one daughter and the next daughter you let them stay with does the ADLs that the person does, you want to let each caregiver know what is the basic pattern. Because if you go different than their pattern, it confuses them more. And we do this with all neural dysfunction. You want to assist them by having pictures for facial recognition. Drug therapy on the market, Aricept. Aricept is the classic on the market. There's others, but this was one that was first used big time for Alzheimer's. Antidepressants can be used. And Valium can be used if they're anxiety prone. If they're roaming and you want to get them to sleep, you want to build up a blood level like Haldol. Some people are on Seroquel. But one thing to remember, if you give any of these medications, the side effect that you need to watch for is their perception is altered. It's altered already, but their perception is altered, thus they are a safety risk. You need to alert that to family and patient. You need to promote rest times. And you also want to keep others from, someone with Alzheimer's can be a risk to somebody else if their perception of that person is someone that's going to harm them. So you need to protect them and protect them from others who may not understand what's going on with this person and their thought patterns. So for test purposes, what I'm going to do, I'll finish up, we're not going to go over that. That's just something to do. I'm going to go over CVA and spinal cord on Friday, and I might even get into some of the peripheral nervous system disorders. I'll finish up on Tuesday. I will give a complete concept blending on that day. I'm going to throw out questions, actual in-class questions to you on Tuesday, and the needs to know, so it will be a comprehensive neural concept blending. you're listening, there's no, your taste, there's no reason why people do well. Okay? Yes,
Are we checking off on trade skills Thursday?
yes. We'll put up the times, but I know,
Is it the same time we've been doing?
yes.